One of the, quote, hot topics, unquote, these days is head injuries in athletes. And what we have learned over time is that young athletes are at very high risk for long-term damage. People who play football when they're 10 don't do well when they're 20. People who play professionally, who've been playing since they were 10, have a very high incidence of long-term brain injuries. What we would hope to do is to have a program to assess carefully all of the athletes in our community for their baseline, and if they have a head injury, what degree of injury and what degree of recovery is going on. We don't want people to stop doing sports, but we do want them to be very aware of the role of head injuries as a cumulative condition. Our program here would take on that group and look at ways to minimize any risk to the young athletes. We've been involved in teaching for the University of California for many years. The facility at Sonoma West in its previous incarnation also was a teaching center for the nursing program from Sonoma State and from the Santa Rosa Junior College. I have residents from the University of California, San Francisco in family medicine, all of whom rotate through my particular practice. We would plan on expanding the teaching role for both outpatient and inpatient services and to involve some of these students in research as well, as that's a topic that's not taught particularly well at universities. The areas we're looking at are currently not done in any institution. For example, a 24-hour headache program doesn't exist anywhere. And in large facilities, it would be hard to bring it in. We can do it here because of our size, because of our association with all the community providers. A program like the stroke program, as I mentioned earlier, is better than most others because of our size. A memory disorder program integrated with various other health providers, behavioral programs, dietary programs, again, can be integrated in this facility because of its size. So it's an opportunity to utilize our small size to provide a different level of service, in fact, a better level of service than is available in larger institutions. An example was in patients with Parkinson's disease who have very complex schedules for taking their medicines every 2 hours, every 4 hours, every 5 hours. If they go into most big hospitals, the medicine says 3 times a day or 4 times a day, and the patients know that they need much more individualized schedules. They know certain drugs used in hospitals often make their Parkinson's worse. We had previously set up an arrangement with the Parkinson's support groups outlining all of their medication concerns, particularly if they're in a hospital. We implemented it previously. No other large hospital ever did that. We will implement it again, the personalized level of care to complicated patients with complicated medication issues. Small facilities are very nice for collaboration. I can literally walk down the hall and talk to my orthopedist or talk to my ER doc. They can call me. We can talk to the dietary staff, the physical therapy staff, the pharmacists. I mean, we're all on a team, and we're literally next door to each other. There are no barriers. There are no big silos. Medical schools, big universities have silos. You know, it's our department and your department. Here it's a joint patient care-centered organization, and we just talk to each other.